Okay, so once again, I'm going to welcome you to the Petersheim Academic Exposition, the Interdisciplinary and Study Abroad poster presentations. We have a series of presenters, and if you wish to ask questions, please hold them to the end of the presentation. There is the hand feature. You also can use the chat feature, which is a little bubble that they use in the comic strips, in order to type out questions that can be answered by typing them. Okay. Okay, so our first presenter, would you please, impact of international dual master's degree program on career outcomes for Chinese students in the US. Would you please share your presentation? And would everyone else please mute their mics so there's no feedback?
And Yan Hao, this is Lisa. I'll give you a 1-minute warning when your time's almost up so we can leave time for questions, okay?
No problem. Thank you so much. Okay. Hi, everyone. Good morning. My name is Yan Hao Wang, and it's my great honor to share my research with you. Last year, I conducted this research on international dual or double degree program and how it impacts the students' career outcomes. So I applied a narrative approach and interviewed six Chinese alumni of a China-American double master's degree program. And all my participants came to the US by taking this program, and they are all teaching Chinese language in the US now. So I have two research questions. The first is, how do they perceive the benefits and cost of attending this program? And second one is, in what ways do other factors impact their career outcomes? So my first finding is about the career-related benefits and costs. The results show that this program offers the students great opportunity to study and work in the US. And students can get one Chinese master's degree and one American master's degree in only 2 to 3 years. So attending this program saves time. And compared to the Chinese one, the American degree is more valuable when seeking jobs in the US or in China. And this program also offers students professional skills and job skills training, like how to develop your cover letter or CV. And it also improves the students' English proficiency and cross-cultural communication skills. And all the skills are very useful when finding jobs in the US. However, some participants said they felt great pressures and have too much work to do in this program. And the workload caused mental and physical issues. And because they were overwhelmed, they had only limited time to find jobs before graduation. And finally, the knowledge they learned may not fit their current position. For example, one participant learned how to teach college students, but she is working at an elementary school. My next finding is about the influential factors. As international students, although all the participants have 2 master's degrees, they still face many barriers in the US. For example, the immigrant policy asks international students can only find the jobs that related to their majors. And their employees must be willing to sponsor their working visa so they can work longer in the US. And some students do not have local professional network, which means they don't know where to find job information. And finally, family support is very important because some participants said they had to return to China because their parents want them to stay with the family. And here is my conclusion. So attending international double degree programs can increase the students' employability or their chance to work in the US. But their career outcomes are also influenced by factors at political, social, personal, or family levels. And among all the factors, immigrant policies, local network, and family support are the most noticeable issues. And that's all my presentation. Thank you so much. I will be happy to answer any questions. Thank you.
Do you have any questions from the audience? Okay, well, I have one question.
Sure.
Okay. What do you see as the future of this program? Do you think more students will avail themselves, or?
Yeah, I think there will be more students taking similar programs because as the development of internationalization, so more people want overseas experience. But however, the COVID has been a problem, and the China-American relationship is another problem.
Yeah, no, I actually have a question too. You talked about the immigration challenges. Is there anywhere at Seton Hall, like the Career Center, or anywhere that helps with that? And would it be a significant help if there was a center at Seton Hall that could help with that?
Yeah, Seton Hall offers workshop or counseling services for international students. It's true, but you know, Seton Hall is just a university and it cannot change the policies. And the immigrant policy actually is not so welcome, especially for students of art and human arts majors. You know, students of STEM majors, they have more opportunities and better policies. For example, they have longer OPT period. OPT means optional, no, yeah, optional practical training. It's a internship chance for international students. But I had only 1 year. My OPT has only 1 year, but students of STEM majors they have 2 years. So it's a huge differences. And I think, yeah, Seton Hall can help, but not so helpful. That's my answer.
Maybe we should talk to some folks in the political science department.
Maybe.
Or diplomacy. Thank you so much for your presentation.
Thank you.
Okay, so our next presenters, and I'm sure there'll be lots of questions for this one also, are the students' experience, the opportunity India offers for business and trade, social exchange, and business management. Would the presenter please put up their presentation?
Good morning. Hi. You are on mute, Martha.
Oh, yes.
Okay. Again, you went on mute.
My computer.
Now it is again went on mute.
My word. Okay, I don't know why my computer keeps muting. Sorry.
That's fine.
Can you share it, or is Burke sharing this?
Good morning.
Oh,
This is Professor A.D. Amar. I'm the professor in charge of doing business in India. We have had this now for 12 years in continuity, and my students prepared the presentation which I am going to narrate, and they somehow, due to their schedule, could not make this morning. And as I told you, doing business in India is the longest survived program in the School of Business, and we have had 12 visits, annual visits for the last 12 years. This year, obviously, we cannot go. The university has its restrictions, and the Department of State also has travel restrictions. So I will tell you what happened last year, and can you make me presenter so I can flip the slides?
You are the presenter. Do you want to share your screen? I can stop sharing.
Okay, then you can move the slide.
Just tell me next slide, please, and I'll move it from there.
Okay, fine. Next slide, please. Okay. Right. You know, we were sitting in the plane when a call came from Maria Buzos. She said, all trips are canceled, and you, I'm calling you to let you know that the trip is canceled. But we were already seated in the plane, and I told her, we are already here and the door is just closing. And if you really tell me for sure, I can ask them to stop and let us out. She said, we are all meeting here, and the board is deciding what to do with these trips, and I will get back to you. And by the time she got back to me, we were already taxiing. And she sent me a text message, and she said, board has made an exception for you, and your trip can go. So this is how our last year's trip began for India. India was at that time, in fact, not really having anything comparing to pandemic that happened later. It was only one place in India from where Wuhan students had returned, or Wuhan students came, and 3 of them tested positive, and they were isolated and were being treated. That happened in late February. I asked students, would they like to travel under these conditions, although we were not going to be closer than 1,000 miles from that spot. Students decided to go. This picture they shared here with the audience is on arrival in Mumbai, and we have our hosts there. They received us, and the way our trip is designed, we have what we call Leave Your Wallet Home program. And Leave Your Wallet Home means they do not pay for anything anywhere. All trips, airplane costs, local, international hotels, meals, gratuities, taxes, entrance fees, everything is included. And so this is why they enjoy. And can you move on, please? Okay. And here, India is by GDP is number 5 in the world. And based on PPP, or purchasing power parity, India's economy is number 3 in the world. And population is at this time at number 2, 1.393 billion is India's population, and is expected to be number 1 most populous country by 2027. And those projections are pretty much certain because we know how people are being born and dying. And so that projection is in fact from the United Nations. And when it comes to number of English speakers, India has number 2 in terms of English speaking population. Please move on. Okay. Here are some of the visits we made. Indian trip is designed to give them an understanding of the business environment in India, and that also includes visiting factories, visiting businesses, visiting government offices, and also giving them introduction to India's sociology, psychology, India's belief system, and all that. So they get a deep understanding of India. They visited a company called Inox Corporation. Inox Corporation is alternate energy generator like wind power and solar mills and all those. It is one of the largest in India and has presence in the United States as well. Students were really excited by how India is moving into the clean energy or green energy area. They visited Birla Institute of Management Technology, where our main focus was at the Atal Incubation Center. BIMT, or Birla Institute of Management Technology, is actually a funded engineering graduate school where a company, a group of industries by the name Birla, they contribute almost everything that is needed to run this university. And their incubation center is one of the best. Here, they bring students who want to start businesses and train them on how to start business, and then they actually start their business right while they are still in the program. The business is registered, they even have their offices started. So when they graduate, they don't just graduate, they have in fact a business running for them to go from the very second day. We also visited Indian School of Management and Entrepreneurship. Indian businesses and schools are getting very heavily into entrepreneurship because they believe India was left behind during the British occupation and had to catch up, and they are doing a good job. We visited Pharma Lab, a company that produces equipment and machinery for pharmaceutical companies. Jay Shah, who is a director, was my student while he was at Seton Hall University, and he did his MBA, went back. It was a family business. His grandfather and his father had been in the business, but his impetus after graduating from Seton Hall University really expanded tremendously the business. This was our third visit to his manufacturing operations, and students really learned how pharmaceutical industries running. By the way, India is the world's largest pharmaceutical manufacturer when it comes to generics, and within this decade, it will become the largest pharmaceutical producer of the world, period. And it is also right now the largest producer of vaccines in the whole world. And so India has moved up ahead. Please move to the next slide.
And Dr. Amar, we have a minute left.
Fine, thank you. So this is now our social side, and students had chosen to visit Banaras or Kashi, and on 2 votes, they decided that they don't want to go to any other city but Varanasi, and this is their Varanasi visit. So please move to the next slide. Here, Varanasi is also the place where Buddha gained his first sermon, and they wanted to visit that place, historical visit. We went there. We went to New Delhi, where they saw the government offices. They visited Taj Mahal, and here are the Taj Mahal. Please move to next slide. And here is the conclusion. So we have, these are the impressions of the students: appreciation for the rich culture, exposure to numerous religious groups living in harmony, view of the contrast between the rich and poor in India, understanding of how highly diverse people coexist in peace, first-hand knowledge of local companies and higher education system. And by the way, India has some of the best technological institutes in the world called IITs. Insight into needs of the Indian people. This was produced by students led by Bob Mulligan, and we thank you to him for making this presentation. Thank you.
And I think we've used up most of our question time, so we may only have time for one question, I think.
Any questions? Well, my only question is in case the students wish to participate, if this trip is going to be going next year, when would they start to look for that information?
University has to first announce, and as of December of this year, no travel is permitted by the university as of now. And as soon as travel is permitted, we will start to promote. It typically happens in March. So we expect to go in March of next year, depending on conditions.
All right.
All right, now we have Elisa.
Elisa, are you uploading your presentation, please?
Yes. This is muting itself. I'm not sure what's going on, but I think I'm unmuted now, so I should be good. Good morning, everyone.
Elisa, it appears you're sharing the Teams application. You might need to share the MP4 or the PowerPoint instead.
Right.
Oh, I did, but it's okay. So the MP4 I created in Teams. That shouldn't be a problem uploading it. Is that correct?
And remember to click the audio.
I am on here. Okay, I'm going to have to stop sharing from.
Okay, so Burke, I have a copy if necessary.
Okay. If need be, if you want to, you can share it, or if you'd like to send it to me, and hopefully I can share it.
Okay, all right. Okay.
My name is Elisa Douglas, and I am happy to share with you this morning the results of my dissertation study on the topic Understanding African Americans' Beliefs, Knowledge, Attitudes, and Behaviors Regarding High Blood Pressure and Their Use of Home Remedies as Treatment. The members of my committee were Dr. DeLuca, who was my committee chair, as well as Drs. Franco and Battaglia.
I don't believe so.
Have the highest prevalence of high blood pressure in the United States, but they also have the lowest blood pressure control.
Hello. Hi. I am so sorry. I'm not sure what happened.
We can see you now, Elisa.
Okay. So it was a recording. Do you want me to try again now, or would you prefer?
Sure. If you can share, if you can launch the recording in like a media player, if you're in Microsoft, it might be, or on Apple, it might be QuickTime, and then share that file. You might have to do it that way. Because while you recorded it with Teams, Teams isn't a media player. You'll need to share access to a media player.
It was an MP4, right, Elisa?
Yep.
It's an MP4.
Yeah.
So it really shouldn't cause a problem. I believe once it's an MP4 document, I should be able to share it without a problem.
As long as it's open, if you click on the file and open it in your media player, then you just need to hit the share button and then share that file. Yep, that would make sense.
Okay, I'm not sure if I understood that, what you just said, but I will. Okay, I think what I will have to do, because I know time is going, what I will have to do is just present it now. So I will just go ahead and open up the documents in PowerPoint, and then I will share my screen, and that should hopefully solve the problem. Okay, I'm not, okay. Options, okay. All right, let's try this again. Sorry about that. Okay, here we go.
There you go. Perfect. You just can launch and you're set to go.
Okay, awesome. Okay, are you able to see my screen for one?
Indeed.
Okay, great. All right, good morning again, everyone. I am excited to share with you this morning my results on my dissertation study on the topic, understanding African Americans' beliefs, knowledge, attitudes, and behaviors regarding high blood pressure and their use of home remedies as treatment. Again, my name is Elisa Douglas. My committee members were Dr. DeLuca, who was my committee chair, as well as Drs. Franco and Battaglia. African Americans have the highest prevalence of high blood pressure in the United States, but they also have the lowest blood pressure control rates of any major race or ethnic group. And out of those who use drugs to treat the condition, only about 45% have been able to attain blood pressure control. According to the American Heart Association, over 40% of African Americans are affected by high blood pressure. This group is also more likely to use home remedies as a complement to prescription medicine rather than as an alternative to the same. And over the past few years, it has been found that more individuals are using complementary and alternative medicine, or CAM, to treat their different health conditions, especially chronic illnesses such as high blood pressure. The primary purposes of my study were to examine the beliefs, knowledge, attitudes, and behaviors of African Americans regarding high blood pressure and their use of home remedies as treatment using a novel survey instrument, which I will discuss shortly, as well as to test the reliability of the instrument in the population of interest, which again were African Americans. So this was a mixed method study that was also descriptive, exploratory, cross-sectional, and correlational in nature. My sample size was 254 African Americans with and without high blood pressure. 135 had high blood pressure, while 119 participants did not have the condition. So they completed the Beliefs About Hypertension Survey, or the BHS, which is the novel survey instrument I just mentioned. And that survey had 47 items, and they did this via SurveyMonkey. Validity and reliability of the tool were established using the Delphi technique, Cronbach's alpha, and exploratory factor analysis, because again, it was a novel survey instrument. So the participants were solicited via Facebook and WhatsApp, and my quantitative data were analyzed using MANOVA, follow-up univariate ANOVA, Pearson's, and Spearman's correlation, while my qualitative data were analyzed using the inductive approach to create themes, and there were 5 themes that emerged from my data. Now I will briefly discuss my results, or the primary results. So my reliability score for the BHS that represented all 4 of my dependent variables was found to be good. It had a value of 0.848. And African Americans were found to be more willing to use home remedies as a treatment after high blood pressure diagnosis rather than as a preventative measure against diagnosis of the condition. This is the table that I created that shows the types of CAM that are used to treat a high blood pressure. Two of the questions on the BHS that participants were asked were, which of the following are used to treat high blood pressure? And which of the following do you use to treat your high blood pressure? The primary responses were lifestyle and nutritional counseling, garlic and herbs, herbal tea, and leafy green vegetables. 77% of participants said that they would use home remedies to treat their high blood pressure if their doctors recommended it, while 58% of participants who have high blood pressure stated that they currently use home remedies as treatment for the condition. I also found that 91% of participants had some knowledge about high blood pressure. However, over 71% of them believe that high blood pressure can be cured. Now, high blood pressure is a chronic condition, and as such, it can be treated, but it cannot be cured. So significance was found only for the behavior variables as well, with no significant relationship or differences found between participants with high blood pressure and those without the condition with respect to the remaining three variables, which were beliefs, knowledge, and attitudes. This is a statement that I included here because I thought it was interesting. This was from participant 57 on the qualitative theme, importance of lifestyle changes. And the participant said, and I quote, "I believe home remedies can lower one's chances of being diagnosed with high blood pressure. And if one does get diagnosed, I believe one should try to change their lifestyle before trying prescription." End quote. So 231 participants also reported that they have at least one blood relative who has high blood pressure, which again shows just how prevalent this condition is among this population. Diagnosis of high blood pressure was not found to affect their knowledge, participants' knowledge of the condition. However, diagnosis was found to be a game changer that affects African Americans' behavior regarding their use of home remedies and their lifestyle habits. Based on the results of the study, it is recommended that healthcare professionals receive formal education about holistic approaches to treating high blood pressure during their medical training or as a refresher course after training. The main problem that we found here is that high blood pressure is not adequately controlled in hypertensive African Americans with us prescription medicine alone. And so there needs to be either an alternative or a complement to these prescription medications. So the results also indicate that more focus is needed on educating African Americans in general about the effects of high blood pressure and what they can do to lower their risk of diagnosis. And further evidence-based studies will also help to increase knowledge and acceptance of home remedies as a treatment option for high blood pressure. Thank you so much for listening. Any questions?
I have a question. Can I ask?
Yeah, sure. Go ahead.
All right. Lisa, what are the primary causes of them having blood pressure in the first place?
Having high blood pressure in general or among African Americans?
African Americans.
Okay, so some of the primary causes are genetic makeup, heredity, lifestyle habits, and we also know that African Americans, as I mentioned, based on the results of the study and the literature that I reviewed leading up to this study, were that high blood pressure is not, African Americans do not respond well to prescription medication for high blood pressure. Okay, so.
And what is in the lifestyle that contributes to high blood pressure?
I'm sorry?
What is in the lifestyle? You said lifestyle as a third cause.
Right. So just lack of physical activities. Okay. Oftentimes African Americans, they do not, maybe exercise as often, or, they're not as physically active as some members, other races. And again, this is based on the literature and as well as their eating habits. Okay. So they may also tend to eat a lot of food items that are high in sodium. Okay. And so as we know that this sodium can also affect high blood pressure diagnosis.
Thank you.
You're welcome.
And I have one quick question. I know other presenters are waiting, but would your research also want to initiate education in the younger generations, say in schools or in feeding the children, so that that lifestyle component might be improved over time.
Yes, absolutely, absolutely. And it's funny you mentioned that because I work with children. One of the things that I do, I work as a health and nutrition manager, and I work with preschool as well as school age the children. And so that's something that I'm trying to do at a larger scale in terms of educating young children about just healthy lifestyle habits. So from nutrition to the importance of exercise and just frequent physical activities and so forth. Okay.
Okay, thank you very much. And if people
Okay.
do have further questions, they can place them in the chat and then we'll get those to you.
Okay, thank you.
So our next presenter, I know they're here. We'll be hearing about knowledge, attitudes, behaviors, and environmental health needs in Latinas in cleaning occupations. Would you please start your presentation?
Hi, my name is Erin Spicer-Ide, and I'm going to share my MP4 with you right now. Can you see the screen?
No.
Okay. Let's see. Okay. Okay. I just did share screen, so
I know our MP4s are not going well.
I'm looking at my MP4 right now. I'm wondering why it's not sharing.
When you open the share tray, and select, there should be a toggle switch to include audio, and then you can select the MP4. Is there a confirmation that you get to then make sure it's sharing?
No.
So when you open the share tray, do you have in the top left corner include computer sound?
Yes.
Okay, so you toggle that, and then select the MP4, correct?
Perfect. Okay. Can you see it now?
There you go. You got it.
Thank you.
Thank you. I'm going to hit play, okay? Welcome to my poster presentation on the knowledge, attitudes, behaviors, and environmental health needs of Latinas in cleaning occupations. My name is Erin Spicer, and I love giving poster presentations in person. This is my first time doing it online, so I hope this opportunity gives you some inspiration and some nuggets of information that you can use possibly in your own research or in your own educational journey. By way of background, most maids and housekeeping cleaners in the US are female, and of those, about half are Latina or Hispanic. New Jersey has one of the largest Latino populations in the US, with about 19% of our state population. Yet there is still a large underrepresentation of this population in health research, and that's one of the things that this study addresses. So the purpose is to explore the knowledge, attitudes, and behaviors of environmental health needs of a bicultural population of Latina women who clean occupationally. So this was a cross-sectional mixed method study and consisted of 3 focus groups. There were 15 women in total. And the focus groups also included a 43-question survey. The participants were recruited from ESL classes in Hackensack, New Jersey. And for data analysis, there were actually 2 parts. So there was the qualitative data portion where the focus group audio recordings were translated from Spanish and transcribed. And then this inductive process which included descriptive and in vivo coding, was followed by the analysis of the quantitative data. And that statistical analysis provided means, frequency, and percentages. So we're going to talk a little bit about the results. There was a lot of data that came out of this, but I'll just highlight a few key things. For the thematic analysis of the qualitative data, looking at knowledge via experience, training typically began at a young age by observation at home. So many of these women learned as kids, as young as 3 or 5 years old, how to clean their own homes. And then as professionals, as adult women, some of them got training on the job, but most of the time the participants in the focus groups did not receive formal job training, and that was really a barrier for many of the women. Variability in attitudes regarding the presence of chemicals in cleaning products definitely exists. That came to light. Cleaning routines were consistent among the women. Participants organized work groups where tasks are rotated and or shared. Most participants are also the primary person cleaning in their home right now. So that represents a compounding of exposures when women are cleaning occupationally and then again at home. Gloves and masks are the most frequently used personal protective equipment, but access is inconsistent. Cleaning related issues are also present, including respiratory and dermal issues, sore muscles and back problems, and in one case, cancer. And then there's varied environmental health needs and a range of behaviors regarding product use. So for some of the quantitative data, you can see here in the middle column at the bottom in the graph, the types of PPE typically worn at work include gloves, masks, knee pads, uniforms, shoe covers, goggles or glasses. But again, what the focus groups really did was allow there to be a deep dive into what were the barriers to using PPE. And some of the things that the women discussed were just very inconsistently being given PPE at work. So if their job was supposed to supply it, sometimes that supply just wasn't there. So there were issues, and this was before COVID. So there were issues with that. And sometimes if the women bought their own PPE, there were issues with access there as well, related to cost and other things. So as you can see in the chart in the upper right, this gives an overview of the cleaning activities and the number of hours per week. So you can see that there's a range from dusting to mopping to cleaning bathrooms and cleaning kitchens, cleaning glass, vacuuming, sweeping, and laundry. So this is a very physically intense occupation with, in some cases, long hours and a lot of repetitive work. So by way of discussion, Latinas who clean houses, apartments, schools, and daycares and universities help protect public health and need to be protected while on the job. Latinas face barriers in accessing training, safer chemicals, and consistent use of PPE. Cleaning at home represents another route of environmental exposures which can lead to adverse health outcomes. So really, in conclusion, given all of these factors, a future educational intervention is warranted that really focuses on training and culturally competent education so that there can be a safer workplace and better health outcomes for this population. Thank you so much.
So are there any questions? I have one. Is there any legislation or any regulations in our state or county on this issue of the use of chemicals and their disposal in their cleaning routines?
There's not any legislation right now that protects this population, unfortunately, but that's a really great question, and I hope that there will be some legislation in the future.
And I just have a comment for the audience here at Seton Hall. I know in the library, our wonderful cleaner is a Latina, and many of them are. They do a wonderful job. Be nice to your housekeeping staff.
Oh, okay. Sorry. Was there any information about the PPE provided to our cleaning staff in McNulty Hall, which also is excellent. They're just excellent workers. But I haven't noticed them having any more than the disposable gloves provided to them.
I didn't look into that as part of my dissertation project, but that's something that did come up among the focus groups that I had, was that for those who were provided PPE on the job, sometimes the size was wrong, like the size of the gloves, or not enough was given. So if the gloves were supposed to be used just for one activity and then tossed out, there weren't enough to consistently do that. So that was a barrier as well. So that's a great point in that it's definitely something that's seen by the women in the focus groups consistently.
Yes, okay. Very, well, thank you. Very interesting presentation. And again, if there are more questions, you can put them in the chat and we'll forward them to the presenter. Okay, so next we have a presentation on accuracy of parents' perception of their preschool children's weight and diet quality, which you, whoever's presenting in this, put up, I see her. Please introduce yourself and put up your presentation.
Hi, my name is Kiran and the topic of my study is accuracy of parents' perception about their child's weight status and diet quality. This is my dissertation study, and my dissertation committee is Dr. Zip, Dr. Cahill, and Dr. Wanderley. Can you see it? Try to upload. No. Is it coming up?
Yep, you just need to launch it now. And you're all good.
How do I do?
In the bottom right-hand corner, there'll be a little picture. It'll look like a projector screen with a line on it. It's right next to the minus sign. And in between the open book, it'll launch your presentation to single slide. Or you can go up to the top where it says slideshow, and then you can click launch from current slide.
I can't see my presentation myself. My screen just shows the other participants.
So you probably need to click on the PowerPoint presentation down in the tray on your taskbar. That'll open PowerPoint for you.
Okay, try sharing again. So we can see the slide, or I can see the slide, and if you can put it in slideshow, it would make it larger, but otherwise we can see it.
I don't see it myself, so I don't know how to put it larger, but should I just present if you can see it?
Yes, go ahead.
Okay, sure. So my topic is parents' accuracy, the accuracy of parents' perception of their children's weight status and diet quality Childhood obesity has become a major public health problem all around the world, including in the United States. According to CDC, 35.4% of United States children between 2 to 19 years old are either overweight or obese. Now, as I'm sure you all know, there are many factors contributing to childhood obesity. This study's focus is about parents' perception. Parents' perception of their children's weight status and diet quality could affect children's health-related behaviors, such as their dietary habits and physical activity level. According to the literature, most parents don't have an accurate perception of their child's weight, and the very limited published studies about how parents perceive their children's diet suggest that, in general, mothers overestimate their children's diet and perceive it as healthy. The purpose of this study is to evaluate parental perception of their 3 to 5 years old children's weight status and diet quality, and to explore if there is any relationship between how parents perceive their children's weight status and their perception of their children's diet status and children's actual diet quality as measured by Healthy Eating Index. This is a quantitative cross-sectional correlational study that used a survey design. The 333 participants, this study used the convenient sampling. The 333 participants were from 44 different states. 55% were female, 44% were male, and they had a wide range of education level and socioeconomic status. Now, this study found that in general, parents don't have an accurate perception of their children's weight status, and they underestimate their children. About 50% of parents underestimated their children's weight status. And they also don't have an accurate perception of their children's diet quality. About 60% of parents overestimated their children's diet quality. There was a significant relationship between parents' BMI and the accuracy of their perception of their children's weight status. Parents with a higher BMI were less likely to accurately, were more likely to underestimate their children's weight status. There was also a significant relationship between parents' socioeconomic status and their educational level and the accuracy of parents' perception of their children's diet quality. Parents' failure to recognize their young children's overweight and obesity status or poor diet quality could eventually lead to higher rates of childhood obesity. The fact that in this study, only 7% of parents reported that they have overweight or obese child, while about 50% of the children were overweight or obese based on their calculated BMI, and only 1.4% of the children had a healthy eating index score that indicated a healthy diet, but 30% of parents reported their child's diet as healthy. So this could show that parents in general may not have enough knowledge about a healthy diet or a healthy weight status for preschool children. Exploring parental perception and helping parents to have an accurate perception may be a small stepping stone, but a truly needed one in reducing the epidemic of childhood obesity. Thank you so much, and if there's any question, I'll be more than happy to answer.
Okay. Was there any correlation between cultural aspects of having children having extra weight as equating to healthiness and a buffer if you got sick or ill, that you would have a reserve, to survive?
In my study, one of the factors that I examined was ethnicity and race. In my study, I did not find any difference based on parents' ethnicity and race and the accuracy of their perception of weight or diet. But in the literature, there's definitely a lot of literature that suggests that parent perception is significantly related to their ethnicity. Some cultures actually their ideal body weight is a bigger body compared to other cultures. In the literature, there's definitely, but my study didn't find that.
Okay, are there any other questions? Well, this is definitely very interesting and very important to future health, because the fat cells we get as a child stay with us the rest of our lives. Well, thank you. And again, if there are any questions in the chat, we will forward them to you.
Thank you so much.
So next, Burke, we're going to, if we can, play the YouTube presentation from the Holy Family Academy in Turks and Caicos. And I see some of their class is with us today. So some are at a national competition for science debate. So if we could hear that, please.
Yes, one moment, please.
And I can see some of the students. Hello.
All right, full screen and share. Oh wait, let me make sure. Go full screen, toggle and share.
Good morning, everyone. Today, my science group, Sarah Aldman, Keegan Forbes, and I, Michelle Williams, will be presenting our science fair project, the Archipelago Bridge, from Holy Family Academy, Roman Catholic School in the 30 Caicos Islands. Our islands, the 30 Caicos Islands, is an archipelago of 40 islands and cays. Throughout the islands, only 8 islands are currently inhabited, and the only means of transportation is by ferry or by plane. This limits the movement throughout the islands, and we wanted a bridge to be proposed that would improve the economic and the social development of the country and the citizens that live here. We have an 8-step procedure. First, we collected surveys. Secondly, we researched bridges and consulted with 2 local engineering firms and the DCR. Thirdly, we explored the possibility of a bridge route connecting South Anchor and Surrey. Fourthly, we designed a bridge that would connect all of the islands. And unfortunately, we were unable to complete steps 5 through 8 due to our limitations due to COVID-19.
When conducting our initial background research for this project, we met with 3 different companies, the Department of Environmental Coastal Resources, EDS, and CSE Limited. We looked into 4 different types of bridges, and we looked at the different possibilities of them in our environment to see which ones were environmentally friendly and most cost effective. And for our results and our bridge solution, we decided on using an exodus bridge and a causeway bridge. For our first route, we had a total travel distance of 46.43 kilometers and a total travel time of 14 minutes and 28 seconds. For the second route, it concluded to a total distance of 33.25 kilometers and then a total travel time of 31 minutes and 4 seconds. For our survey, we conducted this amongst the residents of the Turks and Caicos Islands, and 100% of the results from the survey were positive and agreed to having a bridge in the Turks and Caicos Islands.
We estimated the bridge would cost around $20 to $25 million, as well as another $1 million to pay off the workers. This project will last for a span of 5 years. Each road will have 2 lanes, with one being 3.65 meters wide and a shoulder lane being 1 meter wide. The overall width of the road will be 9.6 meters. We want to use precast concrete because it is more environmentally friendly. Use steel cables for the exodus bridge and coat it with zirconium to slow down erosion. And columns for the bridge can't be higher than 30 meters tall. Other factors to consider would be adding an automatic toll system, so drivers will have to pay a small fee to help replenish the funds for country.
In conclusion, for our project, the Archipelago Bridge, our team looked at a way to create a bridge that will be most cost effective for our islands, 30 Caicos Islands, and we plan to expand our project to the other islands that we didn't get to expand it to this year, which is Grand Turk and Salt Key. And we also want to look and explore the possibility of having a connection between Salt Caicos and Grand Turk.
Here are our references. Thank you for giving us the opportunity to present our project internationally at the Petersheim Exposition 2021. We have truly benefited from the research behind this project, and we appreciate our school and teachers who have helped us in this project. Thank you.
Okay, so are there any questions for our students?
Actually, I have a question, and Martha, I just realized I can't see the chat if there's questions. But I'm wondering, on the islands, do very many people have cars and drive? And, would
My
it...
name is Evangelo, and the topic of my research is exploring the relationship between work engagement and psychological contract fulfillment in healthcare organizations and employed physicians in the U.S.
We've launched into another
Physicians direct
presentation.
87% of personnel, all personnel health.
Sorry about that. I was pre-queuing the next one.
Okay, that's fine. Yes, okay. What about the cars?
Most of the population here drives.
They do, but would this also be used for economic purposes, for transporting goods from one island to the other?
Yes, it would be. A lot of vegetation grows in North Caicos, and the bridges would be most beneficial for that, as well as inter-island travel.
Now, I think today is goods and services people transported by boat or airplane. How do they get from one island to the other?
By boat.
Well, and how long would that take?
Days.
Days. Oh, okay. So this has real value. Now, how long did it take you to do your studies?
We started researching it in 2019.
We did it for 2 years.
Okay, well, very impressive. And I'm sure they will be instituting this project shortly, because it looks like it has real value. Anyone else with questions? Well, thank you for participating in the expo. And now we're going to go to our next presenter, exploring the relationship between work engagement, psychological contract fulfillment in healthcare organizations employed physicians. And it's an MP4. Are you uploading this? Please introduce yourself.
I don't know if you see my face there, but
Yeah.
oh, you do? Okay. Yeah, my name is Evangelo. I just finished my research for a PhD degree. My topic is exploring the relationship between work engagement and psychological contract fulfillment in health organizations and employed physicians. And my dissertation committee chair is Dr. Zip. My committee members are Dr. Zhang and Dr. Battaglia. So I do believe Burke has my MP4. If you could just run it.
My name is Evangelo, and the topic of my research is exploring the relationship between work engagement and psychological contract fulfillment in healthcare organizations and employed physicians in the U.S. Physicians direct 87% of personnel, all personnel healthcare spending, and in aggregate, generate a combined economic output of $2.6 trillion of directed patient care. So physicians are central to the healthcare system and health economics. Now, over the past decade, market forces have pushed both healthcare organizations and physicians to aggressively pursue employment. So more physicians are being employed by the healthcare organizations today. Now, it is in this complex healthcare environment that hospital leaders acknowledge the importance of physician well-being, particularly work engagement. since nearly 80% of today's physicians are currently experiencing feelings of professional burnout. Burnout, as you know, is an antipode to work engagement. The fact is, feeling engaged is a principal driver of work satisfaction in physicians, but physicians' work engagement is low. Additionally, there is this disconnect between physicians' level of engagement and the hospital executives' perception of their physicians' engagement. Furthermore, there's this perceived gap between promise inducement to physicians and the fulfillment of those promises by their healthcare organizations, which are elements of the psychological contract. So there's some trust issues there. So this study is warranted and timely. Now, why? Why is that? Well, because in 9 years, there will be a deficit of up to 8,500 fewer physicians. This is relevant because the US population 65 years and older will increase by 45% by 2030. The physician work group is aging as well. 1 in 4 doctors older than 65 years. 17% of physicians that are not even in retirement age are planning to retire early. And in 1 to 3 years, 48% of physicians plan to cut back on their clinical hours, take a non-clinical job, or pursue concierge medicine. Now, the purpose of this study is to explore the relationship between work engagement and psychological contract fulfillment to do 3 things. 1, to gain a better understanding of the work engagement levels in today's physicians. 2, to assess their perceived level of psychological contract fulfillment, and also to determine if there's a relationship between physicians' perception of their psychological contract fulfillment and work engagement, and to what extent. The study's design was quantitative, descriptive, cross-sectional, correlational, using a 33-item survey that was carried out last summer. And participants were 1,100 physicians that are employed in the same work setting for at least 6 months. Now, the results show 60% of physicians identified as male in this sample, 40% as female, 80% were married with an average age of 51.1 years. Greater than 50% of physicians had been practicing medicine for more than 20 years, and 75% were practicing in the hospital environment or the medical group practice environment. Approximately 40% of physicians were practicing in the Northeast. Respondents represented 42 specialties, subspecialties, with the top 8 specialists representing 53.6% of the sample. Now, descriptive statistics showed an average level of work engagement, an average level of PCF, psychological contract fulfillment in physicians. Older physicians were more engaged than their younger counterparts, and that goes for experience as well. In one question, when asked, to what extent has the organization met your expectation? Just a little over 50% said their expectations were met by the organization. So a lot of work needs to be done to increase fulfillment. Spearman's role coefficient was used to assess the relationship between PCF and work engagement, and this showed a high correlation between the two. Logistic regression was used to analyze the predictive effect of work engagement, adjusting for the control variables like work hours, gender, experience, and these showed strong evidence for significant positive association and predictive effect of PCF on work engagement and its dimensions. Physicians' work hours had a significant effect, so did years of work experience as well. So it can be inferred that a physician's perception of a psychological contract fulfillment is significantly positively associated with work engagement and its constructs, which implies that a physician's higher perception of PCF is associated with higher work engagement, which is expected to positively influence job satisfaction, reduce turnover, retention, and decrease medical errors in physicians. So this study's findings show that planning and implementing policies that improve physicians' PCF experience will only help hospital and health systems realize desirable work-related and job-related, organization-related outcomes. And failure to consider work engagement among physicians is not an option as we seek to provide quality patient-centered care. Thank you for listening.
Okay.
Okay.
Okay, so are there any questions for this presenter?
So I have a question which you may or may not know the answer to, and this is sort of based on conversations with my OBY, who said she's been under constant pressure for several years to join one of these organizations.
Okay.
And the main reason she has resisted is because they limit the amount of time you can spend with the patient, at least indirectly by, I understand you have like a quota.
Yes.
And that would, of course, have a negative impact on our healthcare, one would think. Is that prevalent that the amount of time you can spend with a patient is arbitrarily limited?
It is. It is. That's one of the complaints that physicians have. They feel that their time is being controlled by the administrators. And that's one of the positive things I found regarding the PCF. One of the control variable was physicians want more time. And so increasing the time will actually increase their satisfaction, and that is with their patients. But they have a certain quota they have to make, and if they don't make that, then there's some issues there. So time definitely is an issue when it comes to the physician dealing with their patients.
Thank you very much. Interesting presentation.
Thank you.
Is there any relationship between the insurance companies and this issue of the amount of time physicians are supposed to spend per patient?
Well, not directly. Well, the issues that physicians have with the insurance time, insurance really, it has more to do with red tape, with approvals of certain studies. So they're kind of burdened there. They want to be able to order certain tests whenever they want to. They don't need they don't want pre-certifications in a sense. So there's a pressure as well there that comes from the insurance as well as from the administrators as well.
Okay, well, thank you for clarifying that.
Thank you.
Yes, and again, we'll review the chat at the end and send any written questions on to the presenters. Thank you. Our next presenter, interprofessional education towards practice, mixed methods, exploration of respiratory care, students and therapists' perception. Please introduce themselves and make their.
Hello. Hello, everybody. Yeah, my name is Ziad Al-Nufai. This is part of my dissertation defense. I'm going to share with you tonight. The title is Interprofessional Education Toward the Interprofessional Practice, a Mixed Method Exploration of Respiratory Care Student and Therapist Perception. My committee member is Dr. Zib and Dr. Duluka and Dr. Kehel. Do you see my poster?
No, we just see the place to get to your poster. It needs to be.
Do you see it?
Not in full, but can you help us?
You may need to unshare and then just reshare the presentation, because if it wasn't open when you first went to share, you wouldn't have had access, and now that you've clicked on it, you should.
Okay.
If it helps, I can just share it for you.
Thank you, Buck.
I believe I have it right here. Is that correct?
Is it there?
Is that it?
Yes.
There you go. Best of luck.
Okay. Respiratory care is a healthcare discipline that specializes in providing treatment for patients with acute and chronic cardiopulmonary abnormalities. The actual practice of respiratory care has changed dramatically from a guy who just delivered an oxygen in 1940 to the respiratory therapist today who has a strong skill base and expensive depth of knowledge, which enable them to provide a safe, team and evidence-based effective care for a patient. In 2011, Interprofessional Education Collaborative Expert Panel report 4 competency domain for interprofessional collaborative practice, which is value and ethics, rule and responsibility, interprofessional communication, and teamwork. A healthcare credential organization encourage educational institute to implement interprofessional education, focusing on these 4 domain in their healthcare program. They do not provide any direction of how to best implement IBE. Many respiratory care programs have begun to infuse respiratory IBE experience into their curriculum education program to offer a student an opportunity to learn from and with other professions, and thereby learn more about a cooperative practice in healthcare system. The perceived importance of IBE is that to help to prepare a student to practice for a patient-centered care effectively. Although educators perceive the positive impact of IBE and promote IBB, limited evidence exists supporting this fact or identify a robust teaching and learning strategy that supports the development in the student. Additionally, to the date, there are no published studies that specifically explore and identify the perception of respiratory care. The student, faculty, and therapists regard IBE in promoting IBB. Furthermore, the most effective teaching and learning strategy for promoting IBB and respiratory care. Therefore, my purpose of the study is to explore perception of respiratory care student, faculty, and practicing professional regard IBE and its ability to support IBB, and identify the factor that impact perception of knowledge, skills, and ability toward the IBE and IBB among both respiratory care student, faculty, and practicing professional. My study used convergent mixed method design to answer these questions. The design is described as a collection and analysis of both quantitative and qualitative data, and then used to combine the result of both methods to obtain a complete understanding of the research problem. My survey consists of a 3 sections, which is the demographic profile, the second one, which is the IEPS, the tool, which is valid and reliable. They consist with 12 questions, are framed around the perception of own professional capability, contribution, collaborative with other, and trust of other judgment. The reason for me to select this instrument because it has been found to provide a robust measure of a change to individual learning attitude and perception about the IBE. Finally, the open-ended question consists of 5 questions designed to explore the respiratory care professionals of IBE and the future of IBE for respiratory care and how IBE promote the IBB. My result conclusions show that based on my research question, there was no significant difference in respiratory care student and respiratory care professional perception toward competency of IBE. Also, in addition, there was no significant difference in respiratory care student, respiratory care faculty, and respiratory care professional with and without IBE exposure based upon the IEPS overall score. The result confirmed that exposure to IBE throughout entirely the professional education is incredibly important to respiratory care student career perspective because it's enabled them to acquire the knowledge, skill, and experience required to succeed as a professional respiratory therapist. All these results alignment with the literatures. Therefore, IBE should be embedded into the healthcare program curriculum. When I'm looking at the different format that use in the qualitative section.
Ziad, you just have 1 minute left.
Okay, no problem. I'm finished. I'm wrapping up. When I'm looking for the qualitative section, when I look to the deliver and promote IBE experience, most participants who were exposed to IBE in their academic environment choose the simulation format. The current study findings are supported by experiential learning theory. In conclusion, I would say that all the respiratory care students, respiratory care faculty, and respiratory care professional had positive attitude and perception of interprofessional learning. Thank you.
Well, thank you for that presentation. Are there any questions? Okay. How would you suggest this be implemented? Should it be done in the university setting, hospital setting, both?
Okay, maybe as you see from my dress, I'm not from United States. I'm from Saudi Arabia. We have this lack in information here in Saudi Arabia about the interprofessional education. So, in US, many school right now they implement the IBE. The IBE has many formats such as problem-based learning. There is like flip classes. There is many formats for the IBE. So there many of the schools there in US they already implement the IBE in their program. When I got the idea in the first place, when I got the idea about my research, I was thinking about what can I do here in Saudi Arabia, how to implement this in Saudi Arabia. And as assistant professor now here in Saudi Arabia, our school, it's considered the first school in the region. They use the IBE as a curriculum, but still we are we are still in the foundation. I mean, we not expand this yet.
Okay.
This is my goal. I'm hopefully in the near future I'll expand this in my schools to the other school in the region.
And what platforms do you have to get this out to the entire country, as opposed? I know you're starting regionally, which is a good idea, but what methods would there be to bringing this to other regions of Saudi Arabia?
We use right now the problem-based learning.
Okay.
We use it as a part of our curriculum here, but we are open to any format. By the end, it's all under umbrella of the interprofessional education. So I hope I answered your question.
Yes, thank you. Any other questions? Right. Well, thank you. Very interesting and very important work. So at this time, I'm going to mention that there are some online forum posters. These are students that were unable to present today, but wanted their work visible to the exposition. So if you go to the exposition calendar, you can review those posters there. One is on beach erosion in Bondi Beach in Australia, and the other one has to do with erosion of winter storms, I think in Harvey, Cedars, New Jersey. I'd like to thank the participants. There is a minute or two more of questions if someone does have one. Well, thank you very much. As I said, the recording should be available, and if you wish the link, it should be posted on the Petersheim calendar of events website, so you could just view it there. If you need the link separately, please contact me. I'd like to thank Lisa, all our presenters, and Burke, our technical assistant, and please participate in some of the other exposition calendar events that are going on today through Friday.
Thank you, Martha, for your work on this. It's pretty impressive. Thank you so much.
Well, thank you so much also, and thank you, Lisa.
Oh, you're welcome. And despite having a few MP3 problems, we managed to get finished right on schedule. And Dr. Amar, I'm so sorry that it sounds as if your trip to India may not be going ahead, although maybe that may change, because that sounds like a wonderful opportunity for our students.
That's right. Thank you.